Imagine a world where a simple month-long treatment could revolutionize the way we approach atrial fibrillation, AF, patients undergoing a procedure called PCI. But here's the catch. The results are so promising, yet so unexpected, that they leave us with more questions than answers. The OPTIMA-AF trial. A game changer? In a groundbreaking study, researchers explored the potential of a shorter dual antithrombotic therapy for AF patients who had undergone PCI. The results were eye-opening. A mere 1 month of treatment with a direct oral anticoagulant DOAC and AP2Y12 inhibitor was just as effective as a year-long combination, and it significantly reduced bleeding risks. However, the trial's findings come with a caveat. The event rates were much lower than anticipated, which complicates our interpretation. Dr. Sana Al-Khatib, an electrophysiologist, highlights this concern, stating that while the trial addresses a crucial clinical question, more data is needed to confirm the findings. The controversy unveiled, and this is where it gets controversial. The trial's limitations, including the lower-than-expected event rate and the inclusion of predominantly East Asian patients, raise questions about the generalizability of the results. Dr. Al-Khatib admits that she personally wouldn't change her practice based on these results alone. She emphasizes the need for further trials with diverse patient populations to truly understand the impact of this shorter treatment duration. Unraveling the OPTIMA-AF trial. The OPTIMA-AF trial enrolled over 1,000 patients with AF and coronary artery disease, CAD, who required PCI. The patients were randomly assigned to either a 1-month or 1-year dual therapy regimen. The primary focus was on preventing thromboembolic events while minimizing bleeding risks. The results showed a non-inferiority in the primary efficacy endpoint, with a slight numerical increase in all-cause death for the shorter treatment group. However, the primary safety endpoint, which measured major and clinically relevant non-major bleeding, favored the shorter duration therapy. Impact on clinical practice. Dr. Manesh Patel, President-elect of the American Heart Association, AHA, acknowledges the common issue of lower-than-expected risks in clinical trials due to improving healthcare standards. He suggests that while the trial's findings are promising, the differences in risks between East Asian and other populations should be considered. Patel predicts that for AF patients with an acute coronary syndrome, ACS, undergoing PCI, the current practice of 12-month dual antithrombotic therapy will likely continue. However, for those without an ACS, there might be a shift towards shorter treatment durations, especially for patients with lower bleeding risks. The bottom line. The OPTIMA-AF trial presents an intriguing possibility of a shorter, safer treatment for AF patients undergoing PCI. However, the need for further research and the consideration of diverse patient populations are essential steps before widespread adoption. What are your thoughts on this potential paradigm shift in treatment duration? Do you think the benefits of a shorter treatment outweigh the potential risks? Share your insights and let's spark a discussion.